Hello and welcome to Global Health TV and our exclusive reports from the American Diabetes Association's 82nd Scientific Sessions in New Orleans, the world's largest scientific meeting focusing purely on diabetes. Globally, 537 million adults are living with diabetes, 1 in 10 of the adult population. Over 3 in 4 adults with diabetes live in low and middle income countries. Diabetes is the most common underlying chronic condition in the US. In fact, 133 million Americans currently live with diabetes or pre-diabetes, and in the last 20 years, the number of Americans diagnosed with diabetes has more than doubled. In this show, Ashby Walker from ADA's National Health Disparities Committee shares some of the top abstracts investigating disparities in diabetes outcomes, treatment and care.
The American Diabetes Association's National Health Disparities Committee is really proud to showcase and highlight 10 abstracts, and all of the abstracts focus on health disparities.
But first, Ania Jastebroff shares results from the groundbreaking SURMOUNT-1 trial. The drug tirzepatide shows great promise as a treatment for type 2 diabetes by significantly reducing obesity.
The SURMOUNT-1 trial was a trial of safety and efficacy of tirzepatide, a novel GIP/GLP-1 receptor agonist in individuals with obesity. The trial randomized 2,539 individuals with obesity. All the participants were randomized to either placebo, tirzepatide 5 milligrams, tirzepatide 10 milligrams, or tirzepatide 15 milligrams. The trial was 72 weeks in duration. In the SURMOUNT-1 trial, all 3 doses of tirzepatide demonstrated substantial, clinically meaningful, and sustained body weight reductions compared to placebo. Weight reductions on tirzepatide were 15%, 19.5%, and 20.9% on the 3 doses respectively. The doses were 5 milligrams, 10 milligrams, and 15 milligrams. Weight reduction target of greater than or equal to 5% was achieved in 91% of individuals taking tirzepatide 15 milligrams. Up to 57% of participants achieved the greater than or equal to 20% weight reduction target, and up to 36% achieved the greater than or equal to 25% weight reduction target with tirzepatide. Weight reductions were sustained over the 72 weeks of the treatment period in the trial, and all pre-specified cardiometabolic measures improved with tirzepatide. Obesity is a chronic treatable disease. We should treat obesity as we treat any other chronic disease, with effective and safe approaches which target underlying disease mechanisms. And these results underscore that tirzepatide may be doing just that. Remarkably, 9 out of 10 individuals with obesity lost weight while taking tirzepatide. These results are impressive and an important step forward in potentially expanding the effective therapeutic options for people with obesity.
Now, diabetes is a global problem. Ashby Walker from ADA's National Health Disparities Committee highlights leading abstracts investigating disparities in diabetes outcomes, treatment and care.
This year, the American Diabetes Association's National Health Disparities Committee is really proud to showcase and highlight 10 abstracts. And all of the abstracts focus on health disparities and were selected because they met certain search criteria and were reviewed by our committee in terms of being able to make a meaningful contribution to our understanding of health disparities in diabetes and also approaches to addressing health disparities. So we had a number of abstracts that focused on food insecurity, allowing us to better understand the impact of food insecurity on health risks, both in type 1 and type 2 diabetes. There was a really innovative approach to addressing food insecurity that was selected as one of our abstracts this year, where they used digital health coaches coupled with the delivery of meals to address food insecurity and had really promising results. We also had a number of abstracts that came from large clinical trials that are showcasing findings related to racial and ethnic disparities. And then we had some small qualitative studies that really added to our understanding of disparities in tech use in type 1 diabetes. For the abstracts this year, the words that we used to find the abstracts included things like health disparities, social determinants of health, gender, inequality, health equity. And after we did that search, we were able to identify a body of abstracts that all were addressing health disparities, and then the top 10 were selected. In both type 1 and type 2 diabetes, we know that people from lower socioeconomic status backgrounds have exacerbated risk for morbidity and mortality with this disease. And in type 2 diabetes, we see similar health disparities based on SES. And in type 1 and type 2, we see health disparities based on race and ethnicity that persist independent of SES. So it's essential that we as a field address health disparities in the work that we do, so we know how to target interventions to promote health equity for everyone living with diabetes. When we look at something like the amazing technologies that are being presented here in this very room we're standing in, CGMs and pumps, and the advances we've seen in diabetes-related technologies, the advantages of those are not being celebrated by everyone equally. So we know there are disparities in who is utilizing CGM and pumps based on some of those features that I mentioned before, like SES and race and ethnicity, and really being able to maximize the benefit of all of the innovations that are happening. We have to make sure that everyone is able to have access to the technologies and then make meaningful use of them. So addressing health disparities is important to every single aspect of diabetes care, management, clinical trials, really everything we do. There's many abstracts here at the conference that have been amazing to see related to health disparities. We're grateful for the work that's being done across all of the fields represented here at the conference.
That's all for this show. You can find more of our coverage of ADA here and more from Global Health TV on our website or YouTube channel. So until next time, it's goodbye.